And if we needed any reminder in the Sunday Staten Island Advance, it said it in black and white. And the headline is, "What's killing us?" And I'll just read the first paragraph. "Overindulgence and laziness are killing Staten Islanders at a higher rate than elsewhere in the city. Lack of exercise, eating too much, and smoking among the factors that contribute to the borough's greater mortality rates." As we stand here today, in 2011, the biggest threat to Staten Islanders' health and well-being continues to be Staten Islanders themselves. And what this conference has been about for a few years now is trying to educate people and try to get them to embrace a healthier lifestyle.
Yeah, Staten Islanders don't go for yearly checkups like we should, which may be part of the reason why we have the highest incidence of heart disease in the boroughs, among other diseases. If people aren't having their high cholesterol levels and hypertension treated early, then it is going to lead, or can certainly lead, to strokes and heart attacks. Heart disease and stroke are the first and third leading cause of death for men and women in the country. They are also the most preventable. In 2010, over 1.2 million Americans had a heart attack for the first time or a recurrent heart attack, which means every 25 seconds an American has a heart attack, and every minute an American dies from having a heart attack. Staten Island has the highest rates of breast, lung, and thyroid cancers, as well as melanoma. Breast cancer, of course, is the most common by far. And even more startling than that is that the incidence of death related to cancers is higher than the other boroughs in the city. We need to change to make an impact on our lives, and change in our lifestyle means we have to stop smoking. We have to start exercising to increase the strength of our hearts, reduce cholesterol, and to reduce our fat stores. Changes in our diet mean reducing salt intake, reducing fat and cholesterol, and increasing fiber and eating more fruits and vegetables.
Overuse of carbohydrates. We have an epidemic of diabetes, in this country, and again, much of it is due to carbohydrates as a great part of our diet.
It is extremely common infection. It's actually more common to have it than not to have it in your lifetime. Okay, and it is passed from person to person through sexual contact, not necessarily intercourse. Even close contact will transmit this virus.
You can make a really simple statement about every single drug of abuse. Every drug of abuse that's out there works by increasing a chemical in your brain called dopamine. We all have dopamine. It plays a role in our ability to move. It plays a role in our willingness to seek something novel, our sense of well-being, whether we're happy or sad, and of course addiction.
Deaths related to prescription drug use outnumber traffic fatalities. It's either crushed and snorted, or it's actually liquefied and injected. And that high that you get with abusing oxycodone in this way is the same high that you get from heroin. Pharmacies are not being held up for money. They're not being held up for testosterone and some androgen containing medications, which it used to be years ago. They're being held up specifically for oxycodone.
Tony Ferreri, President and CEO of Staten Island University Hospital. Welcome to all of you. This is a very special moment. We recognize Christine Holly for her contributions and exceptional commitment to promoting health in Staten Island. Christine, please come up and accept your honor. Barbara O'Brien was chosen to be the recipient of the Community Health Hero Award because of her outstanding work as an administrator of the Cancer Services Program and her ability to reach into the community and maximize the program's effectiveness. Barbara, please come up and accept your award. It's been a very successful event today. Congratulations to the honorees, all well deserved. The first class